Hi everybody, today we are going to be talking about using the podiatry drill. So today we're going to talk about just using a sanding cap, which I find is a really helpful little tool. I use it to reduce corns and calluses, and also for that hyperkeratosis that happens around great toes and on heels. So it is an easy tool to use if you know how to use it properly. So today I have a lovely lady here who has some calluses and hyperkeratosis on her feet, and we are going to reduce them for her today. So Sheila, I'm glad that you agreed to help me out with this video today. And so the procedure that we're going to be doing today, you've had this done in the past, so but the only thing we want to worry about is that we're not heating up your feet too much. So if you could help me along and just let me know if your feet are getting a little bit too hot in any
Sure.
spot, okay? You're also going to scream at me if there's any pain. There shouldn't be any pain throughout the procedure, okay? And also another thing that I will warn you about is it tends to tickle from time to time, so just let me know.
Okay, I will.
Okay, great. So Sheila, before we start today, I'm going to get you to sign a consent, okay? And that consent is not only for the treatment itself, but also for allowing us to use this video for educational and promotional purposes. Okay, you're okay with that?
Yeah.
All right, Sheila. Okay, so here's the consent.
Yeah.
All right, so we are going to start. As you notice, I have on my N95 mask, okay, and my gloves, my gown. I'm trying to keep the debris to a minimum here. So I have my podiatry drill here, and it's in a nice location where I can easily move it around. It's on a movable cart, okay. And I have my clean field up on top of the cart. So it's always a really good idea to keep all of your instruments nicely sealed in your proper sterilized packaging prior to starting the treatment. And this is the mandrel that the sanding cap's going to fit on. Okay. And this is the sanding cap itself. So all the sanding cap does is it just pops right on there like that, fits like a glove. Okay, make sure it's nicely in place. I am going to prep the feet. So I like to use alcohol. It doesn't dry out the skin as much as hydrogen peroxide. So I just basically wash off the piece of skin that I'm going to be using. And have my drill ready. Make sure it's nice and steady. You must always have control of this piece. I turn on my machine. I'm going to go up to 15,000 RPM. That's a comfortable speed for me. I like this speed when I'm using the sanding cap. If you go any higher than 15, if you go to say 20,000 RPM, sometimes it overheats a little bit too fast. So you have to be really skilled in order to feel comfortable increasing that speed on your machine. I have a suction integration on my machine. If you do have a suction available to you, then always use the suction. That is going to reduce the amount of debris that's floating around in the room. Great, Sheila. Okay, so we're just gonna lightly tap the skin, okay? So we wanna always move. You want to move it around on the skin. You're always going to check for heat intermittently while you are performing this procedure. You wanna make sure that that skin is not overheating. You will notice that when I hold the wand this way, I support my hand that is in control of the wand on the patient's foot, and with my non-dominant hand, I am actually supporting the patient's foot. okay? You want to be in total control of this machine at all times. And how are you doing, Sheila?
Just fine.
Good. Okay. So the other thing I'm feeling for when I'm swiping on this toe is I'm feeling for that nice flexibility in the skin. So you don't want to go too deep with this. There is a risk of course, breaching skin integrity while you're performing this skill. So you want to just make sure that that skin is nice, soft, pliable, and that's where you're going to stop. Good, and that actually looks quite good, Sheila, so we're going to leave it there. And how does that feel?
Great.
Okay, good. All right, so now I'm going to show you a different way to hold the wand. So I like to hold the wand this way. It gives me more control when I am working on a patient's heels. Okay, so I'm going to again support the foot with my non-dominant hand. I'm going to use my thumb to support this hand and the wand, and then just nice little sweeps across the skin. So again, you're going to check intermittently for that temperature control, okay? And never stay in one spot for too long with this sanding cap. Now Sheila, actually your heels look pretty great today, so this is going to be a quick job. Alright, again we're feeling for the pliability of the skin, making sure it's nice and soft and flexible, and that's where you're going to stop. Alright, thank you very much for watching this video.